Morning, everyone. This is Ron Mankey from Osler. It is a little after 7 on July 6, 2017. We have a webcast being provided to us today, some special guests from Able2. Dr. Pandey and Dr. Peters are the Chief Clinical and Chief Medical Officer for Able2. I thought this was a very important subject that we haven't discussed a lot lately. Both our Medicare Shared Savings Program and our CPC Plus practices, and that encompasses all of you, need to consider and need to have a strategy for behavioral health in your practices, especially now in 2017. And what was unique and what was interesting about Able2 is that they are currently working with 3 of our insurance companies already. So Horizon Blue Cross Blue Shield, United, and Aetna are all working with Able2 already. So I'm not going to steal all of the thunder. I'd like to introduce our 2 presenters today, and I'll check back in at the end. What I think is really important to note here is that Able2 has a very specific role in their organization, and a role that we should all be familiar with, and it's that care coordination role on our side in the primary care world. And you'll hear a little bit more about it during the presentation from the physicians this morning. I'm going to put everybody in lecture mode right now, so there shouldn't be any interruptions. If you have questions, please use the chat window, and I will be moderating from here, and we will get this recording out to those of you who have missed it. Doctors, thank you for joining us, and John, thank you for putting this all together, and please take it away.
Super. Thanks, Ron. It's a pleasure to meet everybody, and thank you for making the time to have us share a little bit about our work. You should be seeing a slide that has the agenda and what we plan to cover today, and a little bit of history about both Amy and myself. So I'll just do a brief introduction, then Amy let you do the same, and then I'll do a little bit of an introduction, and Amy and I will go back and forth to share a little bit about our story at Able2 and the clinical work that we do here. So I am Able2's Chief Medical Officer, Reena Pandey. I'm on the left there. I'm actually a cardiologist by background. Did all my training in Boston, and was on staff for several years at Brigham and Women's Hospital in Boston. And grew up in academic medicine and just appreciated so clearly in my own clinical practice the degree to which behavioral health comorbidities were prevalent and a major contributor to the challenges that my patients faced. And it was clear even at even at a Harvard teaching hospital how much better we could be doing at helping identify the right patients, getting them engaged, and getting them to high quality evidence-based care. And so I joined the team at Able2 now about 4 years ago, when I saw that the team was doing exactly that, and it's been great fun to be able to get more of this critical care to the right people at the right time using technology. So I'll pause there, and actually, Amy, do you want to do your introduction, and then we'll jump in and tell you guys more about what we do.
Sure. Amy Peters, Able2's Chief Clinical Officer. I'm a licensed clinical social worker by background, trained at Columbia University, and then did several years of postgraduate work at the Ackerman Institute for the Family. My passion is really bringing evidence-based care to clinical settings in a very rigorous way. Prior to Able2, I worked in behavioral health hospital settings, as well as designed specialized programs at the agency setting. So again, passion is really taking the research and the literature and bringing it in a rigorous way to everyday practice. I've been with the company, with Able2, since 2010. I built our national network of licensed clinical social workers and behavior coaches who deliver our structured evidence-based programs remotely, and currently oversee all of our product development. It's just a wonderful opportunity to be with you today.
So let me give you just the overview of what we do, and then Amy will dive into much more detail of the program specifics and the structure and the clinicians and all the details, but we have been treating patients since 2011 as a technology-enabled behavioral health care provider. It's just sort of a simple way to think about us. And you might wonder what brought me to this from cardiology, but I think it was very clear that, as I alluded to earlier, behavioral health comorbidities can have a major impact on medical outcomes, and the healthcare system had not been, I think, sufficiently addressing that major piece of a patient's overall care. And what's clear is that we can improve medical outcomes by focusing on behavioral health through evidence-based structured programs, and that's exactly what we do at Able2. Especially as with folks like you guys and others in the provider space who are increasingly taking on risk, are increasingly being judged by quality and outcomes metrics. It's so key to address this, what I call a foundational or core comorbidity. It's almost a prerequisite to enable you guys to do all the other things that you need to be doing to improve a patient's medical health. We also focus on making it easy. As you guys might recognize, and I certainly did in my clinical practice, it is traditionally very hard to get access to, for our patients to get access to good quality care, and delivering the care by phone or by video, using technology to enable getting the right programs to the right patients at the right time can be hugely advantageous, and that's exactly what we tried to capture. We'll get into some more details of this and show you some pictures of our platform and such, but the technology really enables us to do all the heavy lifting behind the scenes, whether it's scheduling or data collection or care coordination. It also is the core of our treatment. The platform actually has our protocols so that there's very good consistency with the manner in which the care is actually delivered, because our providers, Amy will get into some more of the details of this, but our providers are actually seeing this structured protocols on the screen in the platform as they're delivering the care. So there's very high fidelity with the way the treatment is being delivered. And the other trick that we discovered we had to tackle many years ago now was being able to help our partners identify and engage those people most in need. And we'll talk through some of the details. We do some data and analytics work up front. I know you guys do some of your own. With other partners who don't have those capabilities, we help them identify patients who may be at risk, but we spend a lot of energy in helping engage those folks so that we can get them in and get them into treatment in a timely way. And all of that in sum ends up with a great value, right? I didn't used to think about value as a doc, but the quality of the care that's delivered results in very good clinical outcomes, and that good clinical care we've shown and others have shown clearly results in a proven return, and very happy patients who feel better, are less likely to return to the hospital in certain cases, and are more productive in their daily lives. Our partners are highlighted there, as Ron mentioned before. This is just a few of our partners, but relevant to you guys given the geography. I'll walk through this, and Amy, chime in if you have added comments. This is just to highlight, why this matters to you guys and how it might help the team at Osler. For one, we mentioned earlier, improve access. I know from my practice, and we know from others how challenging it can be for patients to get access to care. It can sometimes be a several weeks, often several months wait before they can access behavioral health care. We have been able to ensure offering of next day appointments and most hours of the day, even late at night or early in the morning, to make it easy for patients to get access to care, especially if they're working. And because of the remote delivery by phone or by video, patients don't have to go anywhere. They can be at home, they can be at work, what have you, to get access to the appointments. We've spent a lot of energy thinking about how to get patients activated or engaged. The programs are customized to meet their needs. Patients actually do the program, so 2/3 of the patients will get all the way to the end. We'll walk you through the specifics of what a program means, and patients really enjoy it. So what that tells us is that we've done a good job at actually getting the right people in, getting them engaged and activated to do the work that they need to be doing to get better. We try really hard to make it easy for our partners to save you guys time. We can make the referral pathways very simple. We actually have built a customized care coordination portal that does several things. It enables the referrals inbound and also gives our clinician partners information back about their patients, where they are through the program, and with their permission, we can exchange clinical data and notes so that clinicians are made aware of the patient's progress and their needs. And then we'll go through some of the data. The far right column just highlights the improved outcomes and enhanced care. Patients feel better, and that's partly what brought me here. This works, and it's been decades and decades of evidence that suggests that the kind of work we're doing is clinically proven and evidence-based. And if people get better, depression, anxiety, and stress levels get better. That's been proven in multiple published studies in the literature, and we actually have done many of our own to prove that our manner of care delivery also produces the same kind of very, very high, significant clinical outcomes. And in some, and we'll show you some of our own data on this. At the bottom there, you can see, when you can accomplish all this end to end, you really can make a big difference. And in the end, we have demonstrated that you can, a program like this can, in fact, lower medical costs for patients with often chronic medical conditions with behavioral health comorbidities. Who is it that we serve? So if you think of the spectrum of behavioral health severity, on the far right are patients who would fall in the category of those with severe mental illness. On the far left, more of the worried well. We are very highly focused in the middle, neither the far right nor the far left. The seriously mentally ill, think patients with schizophrenia, bipolar disorder that may be untreated. Those are folks that often, as you guys know, will need a psychiatrist or an in-person, sometimes even inpatient treatment solution. The far left are folks that might be well served by a digital point solution or even their employer's EAP program. But in the middle, it turns out it's a very large group of individuals who are the patients I used to treat, right, and that you guys often treat. They're sick. They often have comorbid medical conditions, diabetes, pain, heart disease, what have you, and at least 1 in 4 of them, maybe more in some conditions, will have a comorbid behavioral health condition. And when the two of those things go together, everything's harder. Adherence to meds is harder. Adherence to lifestyle metrics is hard. Recommendations is harder. Readmission rates to the hospital, ER visits are greater, and there's a real opportunity in there to make a real difference. And it's a very large middle population of folks who often are undiagnosed and as a result of that untreated, and that is really our sweet spot. And so the next slide highlights more distinctly, and just to point out that as we partner together, the initial intent is for us to focus together on the patients that we have access to serving as able to through Horizon and through Aetna, which I think covers a large swath of the patients that you guys are currently treating. Amy, I'm going to pass the baton to you to talk in more detail about the actual specifics of the program and the treatment protocols.
Sure. And so this slide really highlights what your patients will experience in our program. Just to reiterate that all of our sessions are delivered by phone or secure video with the therapist connected to the platform as well as the patient. And I'll talk a little bit later about the specifics of our clinicians' background. But after you make a referral to Able2, one of our licensed clinical social workers is going to be scheduled to do a full initial consultation. So this is really a full comprehensive mental health evaluation. This is our opportunity to administer structured assessment. So we administer the depression, anxiety, stress 21 measurement, really looking at those 3 domains as they have a big impact on an individual's physical health as well. We look at work productivity, complete a substance abuse screening, and really finish the diagnostic assessments. It's an opportunity to triage folks into an Able2 program, or as Rena had pointed out earlier, that if a patient of yours does have a higher need than Able2, We make connections to community care and to case management resources. We also, can help with connecting to other services for folks who don't meet the threshold here. But really, 70 to 80%, 78 to 80% of folks do enroll in our program and go into our 8-week structured protocols. So I'll give you a little bit more specific about the areas that we cover in the next slide. But essentially, our 8-week programs consist of a 45-minute appointment with a licensed clinical social worker each week, as well as an appointment for coaching each week. The coaching piece really helps to reinforce a skill attainment over those 8 weeks. Again, by phone or secure video based on the patient's comfort level and preference. And we have spent quite a number of years developing evidence-based protocols. So you can, you may be familiar with motivational interviewing, cognitive behavior therapy, acceptance and commitment therapy, mindfulness, and the like. And what we really do is that based on the assessment that's completed, we make sure that the patient receives the protocols that are going to get them well as quickly as possible and are going to address their symptoms, really address their symptoms, both on the behavioral health side as well as the lifestyle management side. We also have support, post-discharge. We look at the types of services in the community or otherwise that are going to help with continued progress. We have a digital platform, and I'll show you what that looks like in a few more slides, where patients can continue to monitor their progress, to use our resources, and to let us know if they need additional help in the future. Routinely, though, we do check in with our patients, usually at 3 months, and then again we'll check in with them at 6 months if they, if they're stable at 3 months. And we can offer additional sessions. We call these booster programs, just to strengthen skills and to support folks. Throughout this entire continuum, we're coordinating care with medical providers, PCP specialists, nurse care coordinators, and that's really key throughout our whole flow. We can go to the next slide. I just wanted to give you a sense of, really how our programs are set up and how we see them. With all of our programs, we're looking at the medical components, the behavioral health factors that are impacting an individual's health, as well as life events. Here are some examples, that you can see on the screen. These really cover the majority of the high-cost medical conditions and high-cost, most common behavioral health conditions that can impact an individual's health. We make sure that, we really, treat each of these domains, which is fairly unique. Really, traditionally in my background, you've either, treated the medical or you've treated the behavioral health, but that a behavioral health program rarely focused on both, behavioral health and the impact of that condition on the person's medical. And we really specialize, in bringing these areas together and creating a unique treatment plan for each patient, again, to accelerate their progress. Serena, I can hand it back to you for outcomes.
Sounds good. When you put together a program like what Amy just described, it manifests itself as very, very good clinical outcomes. And like I said before, again, this is decades of evidence in the literature that suggests that to be true, but we've done our own hard work of our own outcomes research to ensure that we are keeping with the same kind of outcomes. And in fact, the data holds over and over and over. What you see on this slide on the far left is our depression, anxiety, and stress scale, which we have our patients go through at the beginning and the end of every program. So we have these patient-reported outcomes metrics in every patient. On average, depression severity is reduced by anywhere between 50 and 65%, depending on the program, but this gives you an average number. We've published this work several times over, as you can see by the citation there. The similar numbers hold for anxiety severity reduction, stress severity reduction, and we've looked at that over time. We've looked at it by demographic, by gender, what have you, and it's consistent, which is fantastic. The second hypothesis that we tested now several years ago was, can you, by addressing behavioral health comorbidities, really impact medical outcomes, medical utilization, and ultimately cost? And we published a paper, the data which is shown in that middle column. We published this paper with Aetna about 2 years ago now. And we looked out about 6 months at all medical claims for patients who had gone through our ABLE-2 program. So this was a cardiac patient population in particular in this case, versus a matched control population that hadn't done the program. And what we found was about 50% fewer hospital days and about 1/3 fewer total hospital admissions all cause, which was incredible. We've repeated this work and we've seen similar outcomes results, a couple times over, which is fantastic. This is just a sampling of the outcomes research work we're doing. The other medical utilization outcome metric that we're looking at is ER visits, and you can see that on the bottom right. That study is pending with the preliminary data back in about 1,000 of our grads, and we're seeing about 1/3 fewer ER visits, again, in a very short-term period, about 6 months. Just, I think really highlights the fact that there's a very near-term benefit for patients and a near-term benefit in terms of cost reduction. The top right is another endpoint. We mentioned, both Amy and I, the work productivity metrics that we look at. Not directly relevant for you guys, but just important to know that patients are less likely to be filing claims for disability, less likely to go out on disability, they're more productive at work, and those are just added benefits above and beyond the clinical and the cost benefits we're seeing. This next slide is specific to Horizon, so it's really to give you a more geographically representative patient population. The prior slides represent the entire country, but the Horizon data, of course, represents New Jersey. So what you're seeing here is very comparable reductions in depression, anxiety, and stress to our broader patient population across the nation. On the bottom left, I hadn't mentioned this in detail before, but the patient satisfaction, we have patients judge the program at the end on a scale of 0 to 8, 1 to 8 rather, and it's almost unbelievable sometimes, but it is true that the vast majority of our patients rate us very highly in being satisfied with their program participation. In the middle there is just enrollment. In the middle on the right there are really sort of stickiness metrics. 2/3 or more of patients get all the way through the end of the program. It's 16 sessions over 8 weeks, 45 minutes each. That's a lot. And so the fact that people get all the way to the end the vast majority of the time is really quite remarkable. And on average, people will make it about 6.5 weeks out of the 8 weeks of the program, which is still about 12 to 13 sessions, which is far better than national averages in terms of how patients are engaged with behavioral health programs. Why we get such good outcomes, and Amy spoke to it a little bit before, and I'm going to ask Amy to again walk through some of the details of how the programs are outlined, to really give you a hint at why it works and why we can see some of the evidence that we do.
Sure. So as I had explained earlier, each patient's program has a structured protocol for the interventions that are really going to work to help get them well. And one of the keys to the success is that the therapist and coach work very, very closely to deliver these protocols. But in addition, we have quite a rigorous layer of supervision. Our supervisors oversee each case. They do 100% case note review. They make sure that the therapists and coaches are faithful to the evidence base and work with them through adjusting treatment plans based on the patient's needs or changes to the presentation over the course of the 8 weeks, to manage high-risk concerns with the patient, and really to customize the discharge plan as well. So it's really the the clinical oversight and supervision that is also a really key ingredient to success. We can go on to the next slide. And just to talk a little bit about our, in our network, our licensed clinical social workers have over 10 years of clinical experience. We have a very rigorous interviewing and onboarding process. We've been incredibly fortunate to, from early on, it's important for us to have accreditations, and so we are NCQA certified, a certified credential verification organization, and that allows us to choose our own clinicians who really have telehealth care delivery and evidence-based care delivery as a skill, a skill that they can really hone. And it does also allow us to have delegated credentialing responsibilities. So we take that over for health plans, and that's really valuable. We can expedite onboarding of clinicians based on need, and we do the quality oversight from credentialing to re-credentialing. We also have a very rigorous education program for our clinicians as well. We have monthly speaker series that are continuing education courses that the Association for Social Work Boards has approved. We also just recently got the same type of credential for nurses as well. So, to deliver that. And just to share that our behavior coaches' background, they're master's level psychologists for the most part. Others are nurses as well. So a really, really high quality network, where we can really show, real high performance based on national standards such as NCQA. Okay. On the next slide, we're really showing sort of the flow of our, capabilities from identification to engagement, our assessment, treatment, and maintenance. And what we're highlighting here is, maybe unique to some behavioral health providers in the sense that we have a highly trained engagement center. And why this is important is when you make a referral to Able To, your patient will speak to one of our engagement specialists prior to that initial consultation. That person is trained to describe Able To's programs, to really, help the member or patient describe, what their experience and needs are. They do a benefits check, and they make sure that the patient is matched with, a care team that really is going to meet their needs. And this is also a point of integration in the sense that when you make a referral, you will know the status within about 48 hours of our ability to take that patient into our program, or if there's a different kind of need or a higher level of need, you'll know right away. So the folks who refer from your organization, will have regular interaction, from the very beginning with our engagement center folks. So they're really key players in our solution. Okay. On the next slide, what I'm showing you is some of the digital tools that we have to support our patient experience. And, we really do, we really want to make sure that we're engaging folks in the style that works for them the best. And so, we really do have a digital suite of services that a portion of our patients really, really engage in and really enjoy, feel like it really helps to guide them through our treatment process. Understand it early on, and sort of continue to stay engaged post-treatment. So, we do have capabilities from really describing by email what we do and introducing folks to our platform, patients can take a self-assessment and really get a result around their areas of need prior to the initial consultation, so they really have a sense of what they're going to work on there. This information, of course, is all ported into our platform for a therapist to use. It helps the therapist really gauge where the patient is as they begin their relationship. And it allows us to stay in touch during and after treatment as well. You know, each patient is invited into our patient portal that will guide them through what each session will cover, and then we'll allow them to get a curated set of worksheets, handouts, resources, and exercises, you know, video and audio exercises that will help them really with their stress management and lifestyle goals. So this is important to sort of reinforce. They can follow that, you know, follow that through the course of their program and talk to their clinicians about how those new skills are working for them to manage their health. And then on the next slide is just a quick snapshot of our care coordination portal. So, you know, we developed this for folks who refer in and want to stay connected with the patient's experience through the course of the program. So this is a place where referrals can be made. It's a place where a patient's course of treatment can be tracked, so you'll know what program the patient is in, what those sessions are covering. You know, if there have been any interruptions to treatment, you can communicate with the care team here, and with patient consent, of course, download a full clinical summary that can, you know, be uploaded into your own systems. You know, this is sort of a step towards further integration that we'd love to do with our partners in the future in terms of platform integration, but this is a really streamlined, great resource for really following your patient and you know, communicating bidirectionally with the Able To teams.
I'll jump back in here, Amy. You know, this is just one, you know, a slide showing examples of materials and, you know, that can be used to help engage the patients. You know, helping identify, determining whether there's behavioral health need. They're too small to see on the screen, but we can get you some of the paper copies so that you can see what this looks like, a reference guide for who and how to refer. We have something that actually looks kind of like a prescription form in cases where that feels like something that you can give to a patient that will make them understand the value and the importance of participation in a program. And, you know, just to point out, you know, a bunch of these ideas here are what tools that we use. We make note that it's the physician, and it can be, you know, for you guys, it can be that you are identifying your own patients that have a clinical need and get them referred to us. The other route that we often take is working very closely with a care coordinator or, you know, a nurse or another person on the team who's integral to some of the population health efforts, and get the team set up in the care coordination portal so that referrals can be made very easily into our team, and we'll get in touch with that patient within the next 24 hours most of the time. So there's a lot of different ways to ensure that the right patients are getting to us, and I know Ron and the rest of our team at Able To are working together to figure out what are the tightest integration and coordination points to make sure that as many of the right patients are getting referred to us as possible. And at the end, you know, just to point out, Amy has highlighted this already, but, you know, we're doing a fair bit of coordination and integration to make sure that the patient's experience is reported back to their clinical team, and that, you know, if there are any high-risk features or there's any issues that come up, that we're working together to make sure that those issues are addressed. And then this is actually the last slide, which is just to say, you know, what's in it for you guys? Why do this, right? Why is this important? Why is it valuable? And, you know, we know that you guys are a center of excellence, a patient-centered medical home, and, you know, need to integrate behavioral health increasingly into your day-to-day work. And, you know, your patients are very much in need of this type of care, and to be able to provide virtual access to a behavioral health professional is really invaluable. It's not infrequent that we the healthcare system, not we, able to are afraid of opening the Pandora's box of behavioral health, right, with our patients, because there is too often limited access to high quality and easily accessible care for our patients. But knowing that turnkey, if you will, resources available at your fingertips will, we hope, allow you to be more open with your patients about looking for behavioral health needs and getting them referred into a program that you know will help them get better. And ultimately will lower overall cost of care. At the bottom is just sort of grayed out, but just to highlight that, you know, we know that relevant to you guys is the CPC Plus program, Medicare. And though we're not today treating Medicare patients, just the value of beginning to think about assessing psychosocial needs and having a structure in place for thinking about their resources and supports to meet those needs for your patients is something that will be invaluable, not just for your Aetna, Horizon, United, perhaps patients, but also for the rest of your population. We're starting to think that way and get the processes set up to enable getting those patients to high quality behavioral health care is critical. So I'll actually pause there. Ron, I'll pass the baton back to you, and I think we'll probably have an opportunity to take some questions. We so thank you for your time.
So, Dr. Pandey and Dr. Peters, thank you so much. That was really an excellent presentation, and I took some notes. If I can highlight just for a minute, can you do me a favor, Dr. Pandey? Please go back to slide number 13, if you don't mind, real quick, because I really think it's important here to focus on this one piece. A couple of things that I heard and that I wanted to highlight. Number one, you guys are NCQA certified. The majority of our primary care physician practices are NCQA certified as patient-centered medical homes. That is a perfect alignment. I'm so happy and proud to hear of that. Our team, our providers have been working diligently on their certifications and recertifications. But what I wanted to highlight here is this person called an engagement specialist. And this is the equivalent in our primary care world. This is the equivalent to our care coordinators. This is somebody that knows how to engage with patients. This is someone that understands the behavioral health community. This is somebody that is a patient engagement specialist, if you will. And that's who our primary care doctors can also engage with. Is that a fair statement for both of the physicians? I don't know which one is better served to answer that. Maybe Dr. Peters?
Sure. So yes, your clinicians could, could engage with these, our engagement specialists. They're really the ones that would confirm eligibility, to confirm the patient's initial enrollment in our program and connection with the program, to let you know essentially if the patient's enrolled with us, or if a different resource would need to be located for them. You would also work very closely with our licensed clinical social workers as well, because besides doing the actual treatment, any additional needs, gaps in care, complex questions, or high-risk concerns, it's really the licensed clinical social workers that would directly be involved in that. So, there definitely are times when a patient, let's say somebody who is a diabetic, and we all have some concerns about sort of the level of their blood glucose, fluctuating or becoming very high, and everybody being on the same page about what that plan should be, for that patient. You would, your doctors and care coordinators would be working with our LCSW through those detailed plans to make sure that the patient's following up on the health behaviors that are really required, to manage that condition. And for any clarity around the medical treatment plan, being incorporated into our goals with the patient. So it's really two people. It's the engagement specialist really to say, here's, the member really, sort of belongs in the Able To program, and their eligibility has been confirmed, and it's the licensed clinical social worker that's going to do the more clinical care coordination.
Excellent.
Ron,
Excellent.
I'll
I
just
wanted
mention,
to.
I'm sorry to interrupt you. I love your point about NCQA. Actually, I was down in Washington not 1 week ago meeting with the team at NCQA who has looked at our program as sort of a gold standard of quality. I actually met with the team that launched the PCMH program through NCQA, and they are this week, it turns out, launching a distinction under that PCMH accreditation, a distinction in behavioral health for certain practices that meet criteria for enabling access to behavioral health care. So it's timely and it's wonderful, and we are actually working very closely with the NCQA directly to help them as they continue to enhance their behavioral health quality metrics.
Excellent. Excellent. So I want to also highlight a couple of other things, and then we can wrap this up. So number one, this is working today. For all of my Osler physicians, this is not something that's coming. This is not something that is a good idea. This is being implemented. This is working. This is being executed on with all three insurance companies, Horizon, Aetna, and United. What we suggested was to start with our Horizon and start with our Aetna patients first. This is working today. And one of the things that was also highlighted is we can get to a licensed clinical social worker or a coach within 24 hours. Within 24 hours, this is working today. So I wanted to highlight that because it really is an important distinction. This is not a future. This is a deliverable today. July 6th, 2017, deliverable today. I will end with two other quick notes. The digital tools, I think, are fantastic. I'm sure the digital tools are not for every single patient, not every single time, but I am sure that there is a certain percentage of your patients that are using their patient portal and using their digital resources and digital tools after and through their course of treatment. Really kudos to Able To for putting all of that together. And I'll just close with, while this is not a Medicare approved today, and Dr. Pandey, I heard you loud and clear, this is clearly happening in the commercial world, and it's just a matter of time before you have the ability to manage your Medicare beneficiaries. So CPC plus practices, you need this. MSSP practices, you're going to need this. This is what we're doing, and this is why we've brought it to your attention for the webcast today. I want to thank everybody for joining us. We are at 45 minutes, and I like to do these just under an hour. I thank everybody for joining us. I will open the microphones, although I'm very leery about doing this. I will open the microphones real quick if anybody wants to ask anything. All of the microphones are officially turned on, so if someone has a question, we'd be certainly able to take them live. Able To, please do not get offended. Most of the doctors are either on mute or talking or listening through their computer, so it's very common to not have questions in our webcast.
No problem at all. And if questions come up after the fact, feel free to send them on, and we're happy to address them. Very
good. Well, thank you, Dr. Peters. Thank you, Dr. Pandey. Really appreciate the presentation. Spot on. Jonathan and John, appreciate your support in getting this all put together. Thank you, doctors, for joining, and we will push this out to the rest of our community during this next week. Thank you, everyone.
Thanks, Ron.
Thanks for having us.
Bye now.
Thank you.